Deciding when to do a lumbar puncture in a itty-bitty baby is usually a stressful thing, but I try to keep it simple. If they are less than 28 days old and they have a fever, do the thing, regardless of how sick they look, because they can get sick quickly. That means blood cultures, that means labs, that means urine, that means lumbar puncture. If they are older than 2 months of age, there's some more wiggle room. You might not need absolutely to do blood work, lumbar puncture. However, if they look bad, do the thing. Use your brain. Be a doctor. If they are between 1 and 2 months of age, there's a little bit of a gray area. Still do urine. Swab them if you want, or if you have access to. Do the labs, but the definition of abnormal and when to do lumbar puncture is a procalcitonin greater than 0.5. I like the CHOP, the Children's Hospital of Philadelphia guidelines. They just do procalcitonin based off the most recent literature. They don't also do CRP. Don't be a cowboy. Do what your hospital says. But abnormal is procal greater than 0.5. ANC, absolute neutrophil count, greater than 4,000. If that is abnormal, do the lumbar puncture. Or if those are abnormal and the urine is any positive leukosterase, do the lumbar puncture. But if their urine is positive and their blood work is completely normal, you might not need to do a lumbar puncture in that patient. And I'll say this to parents. I'll be like, there are people way, way smarter than me that have studied this, and it changes all the time. But the most modern literature of when to do a spinal tap is this. And I say it's not something I do lightly. It is something we do often, but it's not something I would want to expose your child to if I don't need to. So it takes more than 2 minutes to explain this to a resident or a family member, but in your head, you should be able to sort through all these things in about 2 minutes.